start today with this orientation session. Many of you are already reading, and some of you will be starting now with the part 3. So it is very important to understand what part 3 is, so that finally when you start reading for it, you actually know how to prepare for it. Because otherwise, many a times you will be wasting a lot of time in the theory and all, and actually which is not required. So it is very important to understand what is the pattern and what actually we need to read, and how much time we need to allocate on the theory and the practice, and that is important to understand. So let's talk about this. So today is the start of structured 6-month paths to the November 2026 exam. And this session really sets the foundation of everything that follows. So settle in, take notes, and bring your questions. What this exam really tests? It is very important that overall, if you look at it, it seems that I should have a lot of knowledge. But actually, lot of knowledge is the enemy of this exam. This exam needs more of your skill and the presence of mind. Okay. Like if you are sitting in your outdoors and you have a patience, knowledge is partly important. You need to know, but then presence of mind is very important. Like at that particular time when the patient is sitting in front of you, how much you can just figure out what is actually the diagnosis and what should be your approach be. That may or may not be dependent upon your knowledge. So some amount of background knowledge is definitely important, but finally it is more about at that particular time how you are dealing with that scenario. So this presence of mind is very, very important in these scenarios, and this practice is very much important. The format and the scorecard. So how you will be scored in these particular stations, that is also very important, because that will help you realize that there are so many things beyond applied knowledge which are actually important for this exam. And applied knowledge is just 1/5 part of it. 20% part is only applied knowledge. Rest is something else. So, how the 6-month system, this is going to help you out. Why it is important to start so early? Why not 3 months before the exam? Because if you start early 3 months, you can prepare in the 3 months, but that will be kind of a overload. Like you have to spend some good time to study. But if you are studying as a 6 month, like 1 or 2 hour of daily practice will actually make you much, much better with this kind of consistent practice. And if you are really taking up the feedbacks very seriously and applying them into your practice, and you take every opportunity in this course to get the feedback, because what are the times when you will get the feedback? One is you are presenting your cases in the live session. So there you can get the feedback there. So you are getting the verbal feedback at that time. And we have also added a very good feature that we are going to send you the written feedback next day also, which you can read in a much elaborate way. Then another thing is homeworks are going on every alternate day, or this thing homework is getting posted, and whenever you post the recording you get a feedback over it. So you have so many opportunities to work on those feedbacks and really take up those feedbacks and even work on one point. See that when next time you do that any station, you actually use that feedback and make better in that particular point. So that is the most important part of this regular practice, which we do in our courses. How the course supports you. So we have live sessions, we have written feedbacks and access till you pass. Library access will continue till you pass. Your live sessions will be 16 as we are starting now. So that will be like this. Why candidates struggle? What is there which makes actually people feel too anxious about the part 3? Not because the exam is hard, but it's because the preparation is unstructured. Many times people just try to like mug up the templates. Knowing the template is a very important thing, but let me tell you exactly, things will come in exam, but they will be only 4 or 5 stations. Rest of the stations will have some kind of a twist, right? And in that case, these twists will work when you know that station from the base. You have grasped the energy of that station. So your preparation should be structured in that way. Too many scenarios, too much content. So do not try to read so excessively, because if you have too much knowledge in your mind, then you cannot speak everything in the 10 minutes. And then you struggle. What should I say? What should I leave? Because I know so much and I'm not able to speak of 5 lines. So what to do? So that's how the people struggle with the time also. So better is pick up the wise 5 lines which are required. Only 5 to 6 lines are required, right? So you need to pick up those 5, 6 lines, and that is what we are going to guide you through. That these are the important points, and should be covered. Rest all you can leave. So therefore, it is very much important to focus on the limited part, which is actually important for the exam. So, no clarity on what examiners want. Again, because many times just people keep on speaking for the management, I should do this, I should do that. But they have actually forgotten many of the things like safety, red flags. They have forgotten to give the contact numbers. They have forgotten to talk about the MDT. They talked very beautifully about the management. But they will gain marks only in the applied knowledge. No marks for communication, no marks for patient safety, and that's what makes them fail. So, exactly, you should keep in mind what examiner is looking for. Studying everything, but the exam tests a small repeating core of skills. Again, it's only the 20 to 30% part of the syllabus which is tested in exam. So, no need to cover from cover to cover, this to this. It's not going to work. So it is not a knowledge heavy exam. As I just explained you, it is an applied skills exam. It's your presence of mind, your practice, the way you can spontaneously handle the patient, naturally handle the patient. That is more important in this particular exam. You don't pass by studying more. You pass by studying the right things in the right format. So this is the main dictum for the part 3 exam. How we will decrease the study time here, as you all, many of you are actually our part 2 students. Some are new students who have joined us relatively in the part 3. We have a dictum of 7% less study time, and we will continue this in the part 3 as well. So it is because we are going to give you the master scenarios which you can use by plugging here and there. Like you can take a part of this, the other part will be discussed in the other scenario. So like this, you can mix and match the scenarios and do your exam performance. Exactly giving you the examiner sheets so that whenever you practice, you know that these 5 things I have to say. Right? Ready to use notes. You have already templates. No need to write or all templates for you. So that is there. And then there are certain universal videos in every module. Initial 3 4 videos, you will find that they are topic wise arranged things. Okay. These videos will give you the idea of how exactly these topics are dealt with. They are not giving you the template, but they are giving you what exactly you need to remember in these particular things. So these are the universal points which you can use here and there wherever required. And real-time feedback. That's always a main important thing. So that's again, we are, you don't need to go back and read to the longer theories and longer talk articles, because everything is designed so that you can just remember what is required. And that's how we are going to decrease your study time as well. What makes us different? Station shots. You have plenty of stations. I mean, the complete library access. Or if you go to the website, every station, every this module, like sub-fertility module, first topic will be expected stations and the reading material required, right? So you will find the expected stations, and you will find in the download section or below the video, there are links to the various pills and all, which is reused. Patient information leaflets, that is the main source of material which is used to make these templates, particularly the role player templates, right? So that is there. And first is expected stations. Let me just figure out how you will understand that. Just a minute. So first thing first, always it will be expected stations. Then second, third, fourth videos will always be general templates, like how the history to history of that particular module has to be taken. What are the common things which are asked? Like if you go with the fertility, then what you need to speak in the male infertility stations, what you need to speak in the female infertility stations. So some general videos are there, 2, 3, 4, 5. Some videos will be there which talk in general about what things to be taken care of any particular thing is coming. Then, then there are 6, 7, 8 or 10, 11, 12, 13, 14. There will be multiple videos which are for the various tasks. Some tasks are done, right? Male infertility, like there is a simple male infertility station. Then there is a station of male infertility with the diabetes, station with male infertility with anabolic steroids. So you will have all those stations listed there. So you can go through all these stations to know how the stations have appeared in the exam. Mostly like 50, 60%, 70% station will be same, but last some point they will change in the exam. So that extra we need to discuss in the classes, and we will be trying to cover up those things as well, so that when you go to exam, you know them as well. So this is all, like when you come to the class, before you come to the live session of that particular module, go through all this content which is mentioned here. There are certain live sessions which you can see right now in the website for every module. That these are the sessions conducted for the old batches. So these will be removed now, right? You will have these all stations in this sequence. So no need to worry about that. Stations will be here, but one station will be there, so that you do not have to go into those bigger live sessions and dig into like what number for what station. That is not required, right? So because we are going to put up all the stations here, one already there. I think fertility and early pregnancy has already been done a lot on it. For the remaining modules, it is constantly in progress and we are doing that. So you need to cover up those stations before you come to the live session. For live session, we will give you the list of the topics, what we are going to take in the class. There will be 16 stations. 8 per batch stations will be covered. So 16 stations will be taken. A and B batch will have different stations, and C will have the repetition of A and B. So this is how we are going to take, and every student is going to present one station. And because you will be having the list of topics, so you can decide whatever you want to prepare, and you can put it in the group as well, that I am preparing this station, so that other students can prepare the different station. I'm not going to allocate that. It's on your choice and first come, first serve, right? If somebody has already written like male infertility with steroids, I'm doing, and then somebody else later on writes that this is male infertility with steroids, then you need to change, right? Because the previously it has been picked by somebody. So you can pick up your station. But my recommendation is that instead of picking up one station, try preparing all these stations, because ultimately, when this module ends after the live session, one after another, you will be going for all the modules. So you will have not much time to cover up the remaining stations. Okay. So better is prepare those and then speak randomly for any one station, because that will give you the best practice. That will give you like how well you can perform when you don't know what is going to come on the screen, because at least here you are knowing that one of these 16 is going to come, or one of these 8 actually, because for your batch, like for B batch, if these are the 8 things, so you know that, okay, that these 8, so at least prepare those 8 and speak up for anything. That will give you actually confidence, and that will give you a habit of coming up with just having a station in front of you and you are able to speak. So that is the purpose. If you prepare one station, it's okay for me. You can come and deliver your station. If you have chosen that and already in the group, and you get the opportunity to do that. But then you will have to cover up remaining, right? Later on. So you need to see like when you can cover up those, because one after another, for it will be approximately 10 days for one module, and the live session is going to be somewhere in the middle. So that after the live session also 2, 3 days are there to finish up all the stations. When this live session or when this complete module time is going on, like if I say 1st to 10th, a module is going on, and 4, 5, 6 is the live session, then during this particular 10 days, 5 stations will be posted in the homework group as well to go through that. So 16 we are going to do in the live session and almost 5 in the homework station. So you will have almost 21 stations practicing live. Rest you have on your website as well for every module. For every station, you will have a complete template, exactly the lines which you can use to speak. You can see those lines, try to figure out like what is written, but it is also important to look like as if you are talking spontaneously. Because the more you look like you have marked up and you are going to throw that thing on the examiner, the difficult it is to score the marks. But when it seems like you are spontaneously talking, that's what the examiner is looking for and the confidence you throw there. Domain wise mark sheets are there with the every station. So it is highly recommended that whenever you practice with your study partner, do mark yourself with this domain wise mark sheets. If you are practicing with a role player who is not like appearing for the exam or somebody, like sometimes people take help of their friends or the family members as well. It's pretty okay. But then record yourself and then mark yourself with the domain wise mark sheets as well, so that your every practice which you are doing actually gives you a proper benefit. And the most important thing is, do practice every day. Even if you are very busy, still take out time for 1 hour to practice every day. One station a day will also make a difference, but do not make it like no station in a day. At least out of 7 days in a week, 6 days, try to do one station daily for now when you are starting here. From August onward, you can increase your speed and do more number of stations, because ultimately you need to speak every station at least 5, 6, 7 times, because these all things have to be on your spinal level. If it is not on your spinal level, then because it's only 10 minutes in the exam, and out of 10 minutes also 2 3 minutes role player will speak, so you will have only 7 minutes or so. Now in 7 minutes you cannot think, you can just speak what you know, and that too also like at a spinal level. Just keep on, things should keep on coming to your mind, you should not be thinking. So that is very very important. Fine, all clear? Any questions till now before I move forward? Anything?
No, ma'am.
Is,
Unclear.
is this clear? Okay. So what we are going to talk about, already I've told many things about it, but still we are going to talk about the understanding exam format, types of stations and the domains tested, how the scorecard works, what to study and what not to study, how to structure your practice and use templates, how to cut study hours by 70%, and how the course supports you step by step. I think the last two questions I've already answered. We are going to see rest of the things. Now, understanding the exam format, there are 14 stations, right? Every task you perform is a one station. So one after another, it's a 14. It's a complete circuit, right? So 10 plus 2 minutes per station. So 2 minutes of the reading time and 10 minutes of the performance. So first 2 minutes are for like you read that station outside, and then next 10 minutes are you are inside the station and you are performing. Okay. Now, how to allocate those 10 minutes effectively? That's what we are going to talk. No preparatory stations. Immediately as you enter the exam, the circuit starts. No breaks during the circuit, right? Usually you do not get any toilet breaks or the water break or nothing. If you have a very much emergency, then you can tell the examiner, but that will be your loss of time. You will miss that time because circuit is going on, right? So no breaks during the circuit. This will be the fastest 3 hours of your life. I tell you, the 3 hours it takes to complete the 14 stations. And let me tell you, you will not even feel that you have done 14 stations. At the end, it will be like, okay, all done. So it will be so quick. Each station marked across defined domains. For every station, there is a domain-wise marking, and then there is a global score as well. So what's examined? The syllabus at a glance. You all know all these module names. I don't need to read them again and again. This is very important. There are 5 domains tested. Now here you will be marked on 5 domains for every station. There may be 3 domains in any particular station. There may be 4 domains in any particular station, but they will be out of these only. So 5 domains tested are patient safety. Are you a safe doctor? That is a question which is answered by the examiner. Does he see you as a safe doctor? Communication with the patients. Does that patient feel comfortable to come back to you if he has to come next time to this doctor? Is he comfortable? So that is communication with the patients. Communication with the colleagues. Communication with the colleagues. You alone cannot do everything. You need a teamwork. Teamwork is must. So who all you are going to involve and how you are going to make it safe for the patient. So that is what communication with the colleagues is looking for. Information gathering, what all you need to know information to come to your diagnosis and management. Applied clinical knowledge always is like interpreting the patient's history, interpreting the patient's reports, and then explaining to the patient what is the diagnosis and what is the clinical knowledge. So if I tell you like in simple language what these domains mean, now I think you can clearly see through like how you have to behave with the patient. You need to be a safe doctor. You need to be very empathetic person so that the patient feels relieved when he talks to you and he feels like coming back to you if at all required. You should involve your colleagues wherever required, and information gathering will be history taking, which we usually do, and then diagnosis and management. Fine. Are the domains clear? Any questions about it? For every domain, there are certain number of points. So suppose if we take that 10 points are there, right? Then out of 10 points, if you have spoken 8 points, you pass. You have 2 points. You get 2 points for it, for that particular domain. If it is for any particular domain, it is 2 marks if you have covered that domain fully. If you have spoken like 50-60% points, it is borderline, and below it is 0. So 2, 1 and 0 is the score for the domains. Now, if there are 5 domains in any particular task, 10 is the total number. So you pass in, you got 8 marks out of it. So 8 out of 10, you score, right? So this is there. Now, if it is you have gained 6 marks out of 10, you are borderline. If you gain 5 out of 10, you fail. So this is how you will be first score for the domains, and then all will be added up to give you a station marks. Now above this, along with the station marks, there is a global score. Global score which an examiner gives you how he perceives you as a confident, safe doctor. So global score is built from your performance across 70 domains. Because why I say 70 domains? Because I have added up all the total number of domains asked in all the stations. There will be nearly 70 domains tested across all the stations, and then accordingly global score is built up. So consistency beats the brilliance, right? So instead of doing 4 good stations and failing 5 stations, it is still better to do some stations as borderline and not the fail. So what I mean to say is that if you do not know anything about the station, it's okay that you cannot pass because you do not know each and everything to speak there. But at least if you do not lose your confidence, you can still make it borderline. And getting the pass, then borderline, and some fail is better than getting some pass and some directly fail. So borderline also sometimes helps you scale. And borderline can be achieved by following the basic principles and not knowing the exact stations as well. So therefore, this is a very, very important thing to understand. That pass, definitely you need some pass station, of course, like out of 14, 7, 8 pass stations, then 3 or 4 you can take it as a borderline, and the remaining 2 or 3 can be fail. That can still make you pass. Now, what you will face? What type of stations you will face? One is a simulated patient, which is basically the role player task, right? You enter into the chamber and the role player is sitting, who is acting as a patient, and you have to talk to the role player. Okay. So, simulated patient task, role player task. Okay. Now, this role player can be a patient, or this role player can be your junior, where you have to teach him. So your role player task can be simulated patient task or a simulated colleague task. In both of these tasks, you are only talking to the person sitting in front of you, and the examiner is just sitting at the side and watching you. He is not actively interacting with you. You are only interacting with the role player. If this is a patient, then we have a simulated patient task. If it is a colleague, then we will have a simulated colleague task. Now, in simulated patient tasks, sometimes there is a third person also sitting there. Okay, third person also sitting there. There is a role player, there is an examiner, and there is one more person sitting there. That one more person is whom? He is the lay examiner. He is lay examiner means he is looking at you from a perspective of a general person from the public, like how he sees you as a doctor. So now in this case, in lay examiner, he does not have any medical knowledge, right? He is just looking at like how you are talking to patients. So now you come to know how important is communication with the patient, because lay examiner marks are totally based on the communication with the patient, how he is looking at like how comfortable the patient is with you, how nicely you are explaining to patient, how nicely you are behaving with the patient. So that is all is done by the lay examiner task. So lay and the lay examiner do have a separate marks for you. Okay, so lay examiner stations are have more marks as compared to the other stations, because here the lay examiner is also marking you separately. So 4 stations will be lay examiner stations. These are usually the emotional stations, like angry patient scenario, breaking bad news, negotiation, like patient is not willing for something, but you believe that this is good for the patient. So you need to negotiate with the patient. So these kind of tasks are, or sometimes like something bad has happened, hysterectomy, cesarean hysterectomy has been done. Now you have to debrief. Now this is something like emotional things, okay? How to handle those scenarios. So these are usually your lay examiner tasks. Teenage patient, sexual assault patient. So they need some kind of special communication skills. So they are your lay examiner tasks, and that is a part of the simulated patient task only. Role player where I've written is basically the simulated colleague task. Then comes the structured discussion. Structured discussion is as if we are talking directly to the examiner, directly to the consultant, and he has some case for you, and you are going to discuss that. So this could be your gynae list, this could be your labor ward prioritization, or any type of scenario where the case is there and examiner is discussing with you. Then it is the then we have, yes, we have the teaching, we have the role player, and we have the structured discussion tasks. These are the different tasks which we have. These waiting list reviews like triage and prioritization, they are all part of the structured discussion only. Now, what is the distribution? Where you 10 plus 2 minutes should go. 2 minutes outside the station, read, plan, and structure. It actually, this 2 minutes is where the complete tasks should go in your mind. You should go through the complete task. Like I'll start with this, then move on to this. Okay, this is this. So complete thing you can revolve in your mind. And this 2 minute practice should start from a very first day, because 2 minutes is a very, very small time and you have to utilize it to the maximum. How you can do practice for this in a daily, like when you are doing these sessions? So basically it is very important that when you will present the case, you will get 2 minutes and you will do that in those 2 minutes. But it is also important when others are presenting the case. You are in the class, you are listening to the cases, but you are not presenting because somebody else is presenting at that time. But these 2 minutes are given to that person, and everybody is silent in the class. We are waiting for that person to finish the 2 minutes. So, why not you also use those 2 minutes and write some points there for yourself? And then once we discuss that station, you can actually check what you thought was actually correct or not. So when you do like this, even if you are attending your own batch session, still you are practicing over the 6, 7, 8 tasks. So this is how you can actually utilize your participation and practice on those 2 minutes. After that, like timely finishing your information. This is important because when you are at your home practicing, time yourself whether you are able to finish the introduction agenda in 1 minute or not. 3 minutes history taking. This is something where people usually struggle. Their history taking will go up to 5 minutes, 6 minutes, 7 minutes, which should not happen. Because if you do that, then sometime when then you will not be able to cover the management and all the patients' questions. So history taking and information gathering, you should be able to finish in 3 minutes, maximum 3.5 to 4 minutes. Then explain the diagnosis. There is a way to explain something, like you have to explain the p prong, right? There is a way to explain it. So you can take 3 minutes to explain it, you can take 1 minute to explain it. So initially when you will start, you might be taking very long time, but then you have to figure out like one sentence so that I finish it in 1 minute. And this is the practice. This you can do by yourself sitting at home also. Just keep the timer along and start speaking like how to explain the p prong. Similarly, the management plan. Now you can see only 3 minutes for the management. So your knowledge is not that much important in this. You know, you need only like important points what you can say here. Knowledge is important. Like I don't want to say that it is not at all important, but not excessive reading. That is not required here. And then conclusion and safety netting, this is how you will at the station. In this, I have not taken out the time where actually the role player will be speaking, but usually you will have only 7 to 7.5 minutes for you to speak. So this is how we'll help you prepare, like to focus on those 2 minutes, introduction, setting the stage, information gathering. And that is why initial 3, 4 days are for the videos, understanding domains, NHS pathways. These 3, 4 initial videos are very, very important. And next 3, 4 days are specifically allocated for that. So that once you go through all this, you build up your basics and then we can follow from there. History no more than 3 minutes, and it is very important to talk about only the targeted questions. Do not repeat yourself. Very important. If some information is already given in the station, please do not repeat it. Use open questions. Very important. To start with the open questions and then move on to the closed questions. Very important that you keep in mind what is the differential diagnosis for this patient, because your history questions should be very much relevant to that, what you are exactly thinking. If you are randomly asking the history, then you are definitely losing marks on it. And try to fix up the main headings for yourself so that even if you are forgetting something, that exactly makes you realize, right, what I am forgetting, and it immediately comes to your mind. Patient friendly language, no jargon. This is very, very important. And good history and communication can pass at borderline. As I already told you, sometimes you do not know anything, but if you follow the basics, you can still pass the station with borderline marks. But weak history across the stations makes passing very, very hard. Domain focused communication with the patients, lay examiner stations live or die on this domain. So, as I said, lay examiner is totally onto this. Ask her main concern, check what she already knows, be empathetic, offer concern when she raises a problem. Sometimes, role player, they will come up with some emotional surges again and again, right? After every 2 minutes, like I'm vomiting. No, you see that, okay, my so much time is going on. Why should I stop here? No, but stopping there and addressing that concern is where you get the marks. if you just stop and speak about that, you may lose some 2 3 points of the applied knowledge, but that's okay. Anyway, you are getting only 2 marks for the applied knowledge. But here, if you are not stopping, you are getting zero for the communication with the patients. So very difficult to digest this, but this is very important point. So you have to, whenever she is like something, you have to stop and see, acknowledge that. So first thing is acknowledge. Acknowledge, yes, something is going on which needs attention. Then apologize. If you ask about something painful, do not interrupt. Listen to the role player. Sometimes it is like she is speaking and you have some points in your mind. So you are on to like, I have to finish these points. So you try to override the role player. Do not do that. Role player is your question paper. She is guiding you. There is no question paper here in the part 3. So it doesn't mean that you have to speak only for 10 minutes, whatever you want to say. That's not going to give marks. Like if it is a topic pregnancy station, I know that these points are of a topic pregnancy and I'm going to tell everything to the role player in 10 minutes. But she had some question, you did not answer that. So you lose the marks. So it is not about what you know or what the guideline says. It is about what role player wants you to ask. So always concentrate on the role player's questions. So draw diagrams to illustrate and then checks the understanding. So these are the things which we will be repeatedly practicing in our stations. Applied knowledge, of course, this is where actually your knowledge will come into action. You interpret, you investigate, you manage according to the guidelines, recognize the risk. And it is not just about telling the risk, always follow it with why. What are the ways to reduce the risk? Justify your investigation. Don't just say that I'll do hemoglobin, I'll send your blood for CBC, I'll send you this. Why? I'll send your blood for CBC to look for the hemoglobin levels, to look check for the anemia. So this is important. Why I'm sending this investigation? So never it should be. Similarly, if you are examining, why? What do you want to see for the exam? So that is important. Don't just say that I'll look at your weight and I do this and this. What exactly you are trying to do? This is very clear. Always give risks and benefits of every option. Like sometimes the role player definitely asks you, which is good for me. This is a trap. Do not say which is good for me. Give her all the options and then give her like these are the pros and cons so that she can select one. Because if you say this is good for you, doesn't make good because that's not a patient safety here. Conservative medical and surgical options all needs to be discussed. Starting from no treatment is also a treatment. Okay. So that is also very important. Communication with the colleagues. Always think about the colleagues you need to be with because you can never be a team yourself. So you need help. Psychological support, safeguarding, refer to right specialty, handle teaching and bullying scenarios calmly. So these all are points for the communication with the colleagues. Patient safety, very important. Like many people, they find the patient safety very difficult, but actually it is not difficult because if you are following the basic norms of the station, it becomes very easy. So from the very beginning, confirm name, age, rule out contraindications whenever you are giving any drugs. Maintain confidentiality as required. Red flag signs, safety advice, safety netting, we call it. Like tell her these are the red flags, you need to come back. These are the contact numbers. Always include safety netting. Check for the allergies. Provide her written information leaflets. Involve the MDT, whoever is required. Then verify the name and age before you talk about any reports. Emergency contact number, WHO checklist for surgical procedures. So you can see these are repeated. And whenever we talk about the clinical governance parts, that is the incident reports and all the Ds, that this is all a part of the patient safety. So many things about the patient safety. If you follow these norms, it is very good. Why starting now, not in August? I think that we have already talked about the earlier you start, you have a good foundation. You have some time to actually read from the foundation. Right now, if you are starting, it's not about rushing. Like every day you have to do 5 stations. You can give some time to structure yourself and start from the base. And the performance is built by the repetitions and not reading. It is you read, but then you speak. And repeated speaking is what is going to help you out. 6 months of structured practice beats 12 weeks of cramming every time. So that is what is very, very important. So how we support you is daily practice plans, examiner style feedback, scenario based practice is there, but it is now on to you, like how much you participate. If you are not attending your live sessions, then I cannot give you the feedback, or the mentor who is taking the class cannot give you the feedback. So you will not get the opportunity to make better. Secondly, homework tasks. Do attempt them. Do take out time to attempt the homework task, because again, it gives you a daily opportunity to improve on. And please, please, please have a 2 3 study partners, not just one, at least 3 study partners, or 4. You can make a group of 4 also, because see, everybody has a life, parallel life going on. Somebody of the other person will be busy, like he might have some emergency, he might have something at home, everybody is having the kids, family, many of you must be having. So you don't never know when you get busy, and then it is about like the other person is stuck now, how to read, she's busy. No, that is why you have a group of 4 people, so that if one is busy, other 2 are available. Because as the exam approaches, these things become very panicky. And at that time, you start searching for more people around. But it's better like if you can start from the very beginning like that. So do not just rely on one study partner, at least have 2 3 4 study partners. That's very, very important, right? And practice as much as possible. Do your stations repeatedly and ask your questions, ask your queries. That is what we are going to do. And this is what I am telling you. No course is doing this, right? But we are the first to introduce this with a detailed written feedback after every live session. And I think the last time when we started in the last few sessions, we got a good reviews from our old students as well. If anybody is there from the older batch, I don't think anybody is. So they can give their opinion about that as well. But yes, it was a very good tool to actually, because you get time to read it and you get time to introspect into it. Recording is also there and your feedback is also there. So you can actually see it explicitly how well you have performed. Every case you present is assessed in writing across each domain, so your progress is visible, specific, and yours to keep. Pre-domain detail, a written record, and know exactly what's next needs to be done. Then the common worries like language barriers can be there. So you can always come back to us wherever you feel, and we can always structure something, take out time to handle that as well. But please do not make your language barriers as a kind of barrier for your success, because you have to overcome it today or tomorrow for the part 3 exam. So please, please, please just forget about these barriers, language barriers, ineffective communication, low confidence, knowledge gaps. Every gap needs to be fulfilled before you go for the exam. So I think I know these are the things which stop people from coming to the live sessions, because they feel that how I will come. Please be knowing that nobody is here to judge you, neither your mentor nor your colleagues, because everybody is busy in building themselves. So somebody may be lagging in one thing, somebody may be lagging in another thing. Someday you may perform good, someday you may perform bad. That's okay. That's a part of a learning process, because if you do not go through this drill, then passes part 3 becomes very difficult. So please be ready with full confidence, enter into this drill, and with this drill you will pass this in one go. So you have all the live sessions, regular homework practice, domain-wise feedback, station shots, templates, and full video and talk library is there with you with existent pass. And that's how it is. Once again, ensure success in 70% less study time. Now the session is open for your questions. Any questions you require, you can let me know. Schedule is already posted in the course group. ABC days are not marked. They're like live session days are marked, but ABC is not written in that. That will be told to you when we start any particular module. Like if for early pregnancy, when it is going to be ABC batch, it will be posted in the very first day. Okay, but the timings, like you know that A batches for the afternoon and B and C batches for the night. So that will remain fixed. Okay. Any questions? Anybody?
Hello, doctor.
Yeah.
Doctor, I read the website, some of it. So when we close the loop at the end, do we have every time to say we will write to your GP, even if the task didn't mention that the GP referred?
Yes. Because ultimately, who will have the continuity of care? Like you are
Okay.
prescribing something, patient has not come to the GP, but you are prescribing something. Who will take care of the patient later in the community?
Mhm. And doctor, for the percentage, do we have to learn them all? Because so much confusion. I always forget. So
See, some
are
percentages
there
are
marks?
definitely important. Like if you talk about
Mm,
the endometrial hyperplasia, like how many percent people are going to develop the endometrial carcinoma. So some
mhm.
percentages are very important. Sometimes when
For
you talk about
complication,
the surgeries, then risks, they are important.
we can't say that's common, rare, uncommon. Doesn't that solve it? Or we
Some
have
things
to
you
learn
can
them?
say, for some things you can say like this is rare. That is okay. But as I said, like it depends on the how important is that number.
Okay. Thank you,
But
doctor.
instead of saying a wrong number, it is always better to say like common this. Because see, like a question about how many extra breast cancer cases will be there with HRT. They wanted the number.
Mm.
They did not want that it is common or uncommon.
Oh, yes.
So some numbers are important that we will be highlighting once we are going through the stations. And that you will remember also by repeated practice.
Mhm. And doctor, you said that we shouldn't lead the patient as for the option as for مثلا water birth, and she's a VBAC, she's a previous cesarean section. So we tell her, but we say it's better for you. We can't say like that. In the stations, yeah, you've written like
No,
that.
we have
We
to
recommend that.
not to use the word like this is better for you. It is more, that is what I'm saying. There are ways of saying that. In
Mhm,
water birth is recommended for women who are low risk, right? In your case,
mhm,
there are certain high risks. So I didn't say
okay.
that it's better or not better for you. I didn't use that word. I said that
Mhm.
this is not we recommend in a woman like you.
Okay, thank you
There
so
are
much.
ways to put up, right? Because if you directly say this is better and this is not better, does not go. Because you are judging, you are being judgmental, you are like guiding her, you are forcing her like go like this. No, it's not your job to force. Your job is to give her the complete information and let her take the decision. So these are the small things we have to learn, right? Anything else?
Hi, Doctor. I'm Dr. Nashwara.
Yeah, Dr. Naswara, yes.
Yeah, the thing is that is there any written format for each topic? Like that in the video I have gone through, there are written template or is there anything like that?
Yes, below every video there is a Google Drive link where you can find the template.
It's like solved answers, anything like that? Solved,
Yes, solved
unsolved.
answer.
Okay, okay,
It is ready
okay.
template. Below every video there is a Google Drive link and you can access through that.
It is that Google Drive link is not the presenter presenting that is not there. It's solved paper only.
Solved station is there in that template.
Okay, okay, okay.
Yeah. Yes. Any other thing? Any other question?
Dr. Bhavna, Dr. Mariam here.
Yeah, Dr. Mariam. Hello. Yeah.
Doctor, just one question. Like when we are introducing to the patient and asking that, may I confirm your name and age, please. Once patient told the name, so can we go directly with the name, or we need to how should I address you?
No,
Because
no need to say how should I address you. You can leave that sentence because that takes time, etc. So you once you have told that, okay, this is your name. I mean, is this Is that Bhavna? I'm talking to Bhavna, 24 years. You can just go ahead with
Yeah,
that.
we can. If patient is saying two names like Sarah Jones, so then can we need to ask that? Can I call you Sarah?
Not really.
No need.
No.
Okay.
No.
Okay.
Because ultimately, if you like see during your 10 minutes, how many times you really need use the patient's name?
Mm,
How many times you speak? Hardly once or twice.
okay.
Most of the time, because when you are directly talking to her, you are directly talking, okay, you do like this, you do like this. How many times you say that, okay, Sarah, do you want to know about this? No, we
Mm,
just ask you, do you want to know more about it? That's it.
mm.
We are not
I
using these names very often.
okay. And one more thing, here it's written full talk and video library. Videos we can open like talk access. It's in the written section. It's where because usually when
If you see the My Library section of your website, you will find a talk library. And if it is not there in your case, it will be added.
yeah, because talk I was unable to open. Videos are there, everything, but talk I couldn't
No,
find.
Talk Library has some videos and some PDFs. So not all are videos. Some videos are there and some are summary PDFs.
So we have to go through from them as well.
Most of the talks which are important and which can be converted into the station, we are using them in a station. We are teaching them in a station form, right?
Mm.
So most of these are already covered here. But if somebody wants to read the talks, like and watch the video, read the summary, then you can go back and check there. But mostly they are already covered in the course itself. So focus on the course first.
Okay. One last thing, Dr. Bhavna. Like, definitely, we know we are all there is so many people will try to make study partner with anyone. But in case, as you said, that everyone is busy and their schedule, work life, home life. So, is it okay, like self practice, to make a recording? Like, at least instead of doing nothing, self practice can we do? Like, just to make us in flow.
I don't want to reassure you, but self-practice actually, it will do only 10% of the job required.
Hmm. That's
It's
I know that's not the exam format, but
No, it's not. Why to waste? See, you have very limited time to study. If you have 1 hour, you have only 1 hour. So why to waste it on the self-practice and not do it with somebody else?
hmm. Okay. Okay.
Mm,
Fine.
yeah.
Hopefully, we will make some groups. Okay.
See, everybody will find, no worries, because everybody has to study. It's not about you or anybody one, right? Everybody has to have. So it's always
Mm.
good to have among yourself because everybody is reading. Because if you take people from different groups, like somebody will be telling, I have seen people doing this. They will go to other groups, they will bring in 2, 3 words from there. Now, then they go to third group, bring other person is bringing 3 words more. And ultimately, that list will become so long that your history will never finish because you
Mm.
have increased it, increased and increased it.
Mm.
See, there are certain things like you may go somewhere and then you may find some very good thing. I don't say that there is no good thing around, but then you have to be very choosy. Like one good thing means only one good thing. But what people usually do is okay, they are telling that these 4 things also need to be covered in history. So I'll ask this as well. But it's not about asking more, it is about asking the relevant things. And
And
by the time you start adding things, the things become so long that your 10-minute station is now not finishing.
mm. Okay.
So
Hopefully,
that
see.
should not happen. That is why it is highly recommended that you practice among the group students. But if not, then if any other friend is there, that is also fine.
Okay. Okay.
Okay.
Thank you, doctor.
Yeah. Okay. Anything else? So everybody ready? Ready for the part 3 journey?
Good evening, ma'am.
Good evening. Yes.
I'm Dr. Monisha, ma'am. Ma'am,
Yeah.
nothing. So while starting a particular module, so is it will do good that we read through the basic templates, all the working stations. So do you suggest reading anything else in addition, ma'am? The PILs, the talk from the
PILs. If
part
you
2
have time,
PDF.
you can read the PILs yourself. You can also go
Okay.
back to your part 2 videos and revise the theory from there, or if you want to go through the guideline highlights. You can,
Okay, ma'am.
because knowledge you have to use from there, and the way of speaking will come from the information leaflet.
Okay, ma'am. Okay. Thank you, ma'am.
Yeah. Anything else? Okay,
ma'am.
so everyone ready for this? Okay, so shall we finish? Okay. So bye bye, take care, and have a nice evening ahead. And we'll continue with the further sessions. Meet again in the live session. And the next 2-3 days, 4 days are allocated for the basic videos. After that, we'll start with the early pregnancy module, and I'll post on the first day all the stations which will be covered in the exam, in this live sessions, and how the ABC batches will have all these things you will get in the course group. Just keep following your course group and the website content. That's all is required. Okay. Bye bye. Take care and have a nice evening ahead.
Thank you so much, doctor.
Thank you.